anxiety because of before the class, whether they can get the internet, whether they can access to the internet, whether they can start the class. And there are so many things that make them be very cautious and anxiety. And this has become another factor which we look into it. And if you look in this case, this girl, if you can see the picture, anybody can give me any point of what this the girl doing? Anyone want to share to me what this picture shows? Hello,
Mobile.
anyone?
Maybe he's playing mobile in a game in a
Mobile.
Yes.
Okay. Thank you. Thank you. Anybody else? Anybody else? Thank you so much for your opinion, for your view. What else you can see from this picture?
But she is under the mosquito net. In a
Under the
garden
mosquito net. Wow.
That's the thing. That is the thing. In the garden or in the jungle, I don't know. But
wow. Good.
under the mosquito net. That's something.
Yes. Wow. Good. You're good. You're very observant. Anybody else? Another one opinion? Any view from this picture? Very good. I like. Very observant. So this is the real case. What happened in Malaysia? One of the become very popular. Even she come out in the BBC news because she's the student from University Malaysia Sabah, my university. She's very far in the village. So what she has to do? She got an exam, and she cannot get the internet access. So what she did? She go and travel to the jungle, and she climbed the trees, and she stayed in the jungle to finish her exam. So it's become very big issues in Malaysia. It's about in last year, June, July, even she come out in the many news what happened to the internet connections in Sabah and Malaysia and so on. So what happened? She has to be in jungle and she has to sleep. So in order for that, she has to wear the net. So very true, whatever you see in the picture. And she's not playing with the gadget. She has to answer the exam because the exam is online. So she has to do it by online. So from all the pictures which I show you, that many students, especially even the universities level, even the primary students, even some of the village students, they have so much of difficulties to access the internet. And even the COVID-19 give them so much of anxiety. Even the other side, like those have internet, they have gadgets and all that, not an issue. But we have to also consider about those poor students, those are living in the village. Okay, now another issue that we also see, a lot of students when they stay at home, what happened? There is another issue which we look into it, is a screen exposed, whereby a lot of students have been using mobile, the gadgets and all that, and they become emotional disturbance because the students are excessively using mobile gadgets and so on. And these are the screen exposed, and there are a lot of psycho-social problem and also physical problem, the eyes problem, and some of them are complaining about the emotional disturbance. Okay, when we are looking to this statistic in Malaysia, which is come out from the Star Graphic. This is one of the popular news in Malaysia. When you look into this health ministry, psychosocial support helpline, when there are many people have been complaining, calling the helpline, and 63.7% of complaining about their stress, their worrying, anxiety, their sadness, and helplessness because of uncertainty of the future. They've been very, they are complaining about the interpersonal conflict with their friends and all that, and they are unable to reach authorities at hotline. So they've been still have complained on that, and most of them, about 65% of students and people are complaining about their stress. And 28% of the people are complaining about the information on the COVID-19, whether it's true or not true, whether the information is valid or not valid. So they have still got some, they need help, and they need, and 28% of the people are complaining and calling the social support to get the information on the COVID. 7.2 on the physical health issues, 0.3 on the marital problems and domestic violence, 0.2 on the financial assistance, and 0.2 on the others. So when we look into this figure, which is come out on this year on January, we can see almost 65% of people are complaining about psychosocial and problems. So what we can do that? So what Malaysian government are doing, we are trying to help them out, especially students, especially in the universities, in the colleges, in private institutions. What we are doing, we are trying to give them the best, especially on their psychosocial support during COVID-19. And what we also do, we are also doing the virtual classroom games more interesting, because when you see a lot of interactions, students are very bored, and sometimes they want the cameras, they want the gadgets, but they are not there. So what we do a lot of interactions with the games and all that to make them interested. So another point that we need to understand, that internal capacity and also external capacity, whereby internal refers to the family members, how much the parents and family members are interacting, and how the external factor, whereby teachers and lecturers, these two elements are very important in order for them to cope with their stress and also their anxiety. And we are looking to this information on just now, the domestic violence complaint, psychiatric problem, health issue, and most of them are complaining about their stress. So what happened in Malaysia, we also have new counseling centers open for community. And this is whereby governments have encouraged, there are many counseling centers in order to help the community, whereby there are students, people, ladies, and young children, students in the villages. So the government have proposed that there are many new counseling centers to open to help those who have been affected. And we also have another point where you also have MHPSS, whereby mental health and psychosocial support to the recommended intervention during the pandemic. So what they can do, they can call the center in order to get some support from them. And we also have the hotline in order for them to social support, which we call as Mercy Malaysia, whereby this is like a befriender, whereby they have a lot of social support to the client who are having mental issues or anxiety, especially those students who are having problems, they have financial issues, they are also, some of the students having a gadget problem, some of them got education issues, some of them interpersonal. They can call this Mercy hotline in order for them to get help. Okay, now the next one, what I want to propose to this seminar, this is the model which we do in Malaysia. I think this has been done in the many other countries also. When we look into this, when you look into the number 8, the pyramid style. So what the government has to, what the organization or NGO have done. So we can look into the pyramid style, which is number 1, expert team. We need the policy making, consultation, health and education, public training and supervision. This model whereby a lot of experts like we, expert in education, we need to make differences in the policy. So we have to work together, hand to end with the government in order to make a lot of change in the policy, whereby we need to give a training and supervision to our students, especially students and also clients who really need our help, number 1. And we also have psychosocial rescue team, whereby these are the team who will be given health education, psychological crisis intervention, consultation, and license psychiatric services. And we have psychological assistance team like me. We have hotline and mental health services. In Malaysia, we do 24 hours per week. And the last one, social support forces. This is what we do. We do a social psycho support in whereby a lot of clients being given a social psycho support in order to cover their mental health issue, and this will help them to overcome. So we have divided the stress level in Malaysia in 4 categories. Level 1, who are affected with the COVID-19. You see the diagram inside. This is those are hospitalized patients with COVID-19, frontline healthcare workers and people who participate in the frontline prevention and control of the epidemic. So their stress level, if you look into this stress level, they are very closely, very high level. And it goes to the second level, self-quarantine patient with confirmed but with mild symptom or suspected COVID infection and patient with the fever or at fever clinics, they have lower stress, and people who are related to the above first and second level population in the rest of epidemic control and prevention personnel. And the last one, people who are affected in the prevention by control measure, epidemic areas, susceptibility population, and general public. So this model, what we can see from this model, we are trying to help the client from social support, especially in a psychological aspect. We are trying to monitor them, try to educate them, give them a social support in order to control their emotions. So if we do that, the level of stress can be monitored. We try to reduce the stress level, and it definitely will help the client or the student, especially in the education setting, in order to help them to recover with their stress and anxiety. So as an overall, what my suggestion is, in order to these mental health issues and education related issues, the most important, the most crucial is the student. So we really need to help them out. And of course, when we are talking about students, definitely teachers are there. And there are also a lot of cases teachers have been affected because of their stress, anxiety, online classes. There are many classes they have to handle. There are many issues related to their schools and work. And of course, when we are talking about students, teachers, definitely we go back to their parents. Whereby in COVID-19 from March 2019 until now, students are with the parents. So there are many other conflicts whereby the parents have to do as a teacher, they have to be as a parent, they have to do household and so on. So parents are all been affected. And the last, as a community. So what we do in this, the pyramid very clearly shows how each and every one are contributing into the social supportive forces in order to overcome their stress and anxiety, in order to reduce that stress level among the students. With that, thank you so much, and I hope to see you more. Thank you.
Thank you, Dr. Balan. That was very interesting. You have a lot of data-based information, and you've been working on the issues that has real information. So the program looks very good and very promising, and I think we should also take all this information into account to develop our programs. So let's go again now to Mr. Chaudhary, Kamal Chaudhary. He's a special guest, and he's from UK. Let's hear from him.
Thank you, Doctor. Thank you so much.
Thank you, Dr. Balan. We'll hear from you later. At the end, people will have some questions. So, Mr. Chaudhary, Mr. Kamal Chaudhary, please go ahead.
Yes, Apa. Ladies and gentlemen, and Mr. Chairman, thank you very much. My talk will be slightly coincided, having heard already two learned professors. So therefore, I would first like you to know that I'm based in London, and I will be talking on the impact of COVID on the students and their mental health with the UK perspective. I shall first also mention that what I will be talking will be more specific to the point, because I've already heard at length the previous two speakers. We all know that COVID-19 pandemic is the biggest health crisis for generations, and it is having undoubtedly a devastating impact on the lives of people across the world. The measures that the UK government has taken to address this crisis, including restrictions on movement and closure of schools to most students, have been necessary to save lives. However, the pandemic and the measures taken to address it also risk having a long-term impact on the mental health of many young people including those with existing mental health issues. I will first try to mention those restrictions that the British government has imposed. The restrictions are, number one, children and young people are not allowed to attend school, college, nurseries, unless they are a vulnerable child. Now, let me say, what is a vulnerable child? This is a group that is either the children coming out of families where the parents are key workers or workers in front lines. And these are grouped as a vulnerable child, that the parents have to go to work and they cannot be left at home unsupervised. So those group of vulnerable child, for them, the school is open and there would be a limited school facilities available to them, primarily to protect them from having to be left alone without a safety net alone at home. And then the second restriction is children and young people are allowed one form of exercise a day. For example, to make a small walk or to run or to do a little cycling, but alone or with a member of a household. The third restriction, when parents do not live in the same household, children under 18 can be removed between their parents' homes. Well, this is self-explanatory. There are a lot of couples here. They are married, but they don't live together. So sometimes they want to have the children between the two homes. So that is allowed. And then the fourth one, all public gatherings of more than 2 people are stopped. And that includes weddings, baptisms, and other religious ceremonies. Now, having those restrictions, now I will explain that these restrictions certainly have had a tremendous impact, negative impact on the students at large and also on the psychology, the mental health of the students. Now, school closures have a limited impact on preventing deaths in adults. We all know that. We know that if we close all the school, the children are considered to be more or less vulnerable to COVID-19. So not much deaths in the UK occurring among the young lives. However, the closure of schools and confinement of students to homes has multiple impacts on children in terms of education, social isolation, well-being, and child protection. Almost all European countries have closed their schools. Sweden is an exception to prevent the spread of COVID. And according to UNESCO, 91% of the children have been impacted worldwide. Schools throughout the UK closed in March last year and are only providing place for some primary school children, as I mentioned, primary school children of key workers and some vulnerable children, which I explained. Some schools are providing learning online, but that is limited to only those who have internet facilities or access to internet. Children from poorer families have fewer resources and they are reliant on school meals and playgrounds for exercise, are less likely to have appropriate access to additional resources to support other activities for mental or physical well-being. Schools provide a safe space for vulnerable children and play a key role in safeguarding by detecting signs of abuse or neglect. Rapid closure of schools, which has had happened last year, has left the vulnerable children without a safety net. And I explained that. And social isolation, the withdrawal of peer support, the lack of structure and support from school, and the increased anxiety over COVID-19 infection, and also the risk to parents are all likely to have a negative impact on mental health of children and young people. Further, increased risk to mental health of children from social isolation will also result from their exposure to domestic violence and abuse during the pandemic. Furthermore, the COVID-19 is having a negative impact on young people's mental health and their access to support. Digital support has been a lifeline for young people, but it is not always appropriate or accessible. As I mentioned, there are poorer families. They don't have internet access or access to internet. Schools play an important role in supporting young people with the mental health, allowing people to have structure and routine contact and trusted adults and peers, and providing support and guidance to young people in terms of both their academic progress and emotional well-being. Now, not having to go to school, therefore, puts them into a very vulnerable situation where the young minds get impacted. With most young people not currently attending school, and many young people not having access to resources and materials with which to learn, there will be subsequent detrimental effect on both academic attainment and well-being. The impact of this, particularly on those who are already disadvantaged, is likely to widen existing inequalities to contribute to a rise of young people looking for mental health support, both during and as we transition out of the pandemic. COVID-19 crisis is likely to have a long-lasting impact on young people's mental health and the services that support them, including schools and children's services. Though time away from the classroom is likely to impact on the academic attainment, there is an increasing evidence that it will also have a detrimental impact in terms of increasing existing inequalities amongst young people. As I mentioned, there are poorer families and there are not poorer families, well-to-do families. So the access of support and materials that they have at home, not many in the UK also do not have, which belong to poorer homes. Therefore, there will be inequalities in their growth and progression as we keep them confined on online learning in the school, at home. For children to continue their studies at home may therefore increase differences in educational progress. The lockdown of educational institutions and schools in the UK has caused a major interruption in students' learning and assessment process for their qualification. I think I will end with that, and I will leave others to carry on. Thank you.
Thank you, sir. Thank you very much for your speech on the issues that is very important in London, and it's also spreading all over the world because we have very good communication with these countries. So now we have today Dr. Panch Ramalingan, who is a very reputed person from Pondicherry University, and I would like to request Professor Akbaruddin Ahmed to introduce him to the audience. Sir, are you there?
Can you hear me?
Yes, I can hear. We can hear you. Yes. You're muted now. We can't hear you. We can't hear you now.
You can hear me now?
Yes, of course. Yes.
Professor Panch Ramalingan is a professor in the Pondicherry University. He also is the president of the Indian School Psychology Association and also president of the School Psychology Association International based in Malaysia. And despite his preoccupations, the fact that he has accepted our invitation and he's here, we are very grateful to him. Yes, Professor Panch Ramalingan, please go ahead.
Thank you very much, sir, for your kind invitation and nicely introducing me. I am very happy to associate with the PRC for their continuous role in this COVID-19 pandemic. When we are talking about the education and mental health of the children in Bangladesh and elsewhere in the world, my concern is in how far we are taking self-care to intervene these aspects. In this connection, I had a webinar with the International School Psychology Association just 2 hours back. That interaction gives me a sense that how far we are taking care of this as a concern in our Asia Pacific region, especially Bangladesh is a forerunner in the Asia Pacific region towards offering postgraduate program in school psychology. Year after year, the budding school psychologists will emerge from Bangladesh, and in turn, there is an opportunity to go elsewhere. Our first state country secretary, Sumaya, now she is in USA. Like that, many are expecting the opportunities to serve at the global level. In this context, this presentation for 15 minutes will enlighten you what are all the starting point and how we are taking care of the school psychologists for their career opportunities and self-care initiatives, and what are all these self-care dimensions, how we are collaboratively working with the other organizations, including Bangladesh School Psychology Society as well as PRC. When we launched this organization in January 2019, the first person we contacted as Professor Akbaruddin. Without hesitating, immediately he supported and encouraged us to proceed further. That given us a strength, being a senior professor, a former vice chancellor, encouraging this multinational activity. Immediately we are thought we can provide a very good platform for the school psychologists in the Asia Pacific region. With his blessings, still I do remember and keeping as a permanent lifelong diary which he has sent through his research scholar Nazir Ahmad. That way he is fond of this profession and encouraging people, involving people. In that respect, he had been with us in Colombo 2020 February. At that time, we are all not aware of this, COVID pandemic and this uncertainty. But we are all just thought that it will, like SARS, it will be vanished within 3 to 6 months. But it was not happened. But it still continues in the name of second wave. These are all challenges to the school psychologists. Before meeting the challenge of this COVID-19 pandemic, we all discussed about the issues of concern like HIV, AIDS, and mental health. These are all some of the issues we have entered. But COVID-19 has made us to think over in other dimensions, as mentioned by Professor Colonial Ashraf, as well as Professor Kamal Chaudhary and Professor Balan Radhakrishnan. Now we realize that these are all an important issue we have to discuss and cope up with the situation. As far as our India is concerned, invariably all the states are affected by the COVID, and likewise this India is least fatality rate, but it is alarming that what will happen in the near future. Till September, we have to be a bit cautious. In that respect, in a traditional way, in India, we used to start providing Khabasuba Kudiner, which is a traditional decoction made up of the herbal products. This is Siddha medicine suggested 15 ingredients, out of which even 5 ingredients are enough to prepare this decoction. You can see the picture, even the police personnel preparing this and supplying to the public. In that way, it was started for the self-care. Our experience at the Asia Pacific level is entirely different from others, and we thought this yoga practice is helping us to have the self-care, and even some of the villages, they are having this neem and turmeric water to be used as a sanitizer. The temples were closed, and people stopped visiting their relatives, and family rituals were curtailed. These are all some of the concerns. So likewise, our school psychologists, while working with the schools, they may found it difficult, and now forced to work with online. Now we have stopped this paper pencil test, and now we are entering into the form of Q Global, so that online assessments are taking place, and one way or other we are reducing the nature of the job, but this is a hectic pressure for the school psychologist to work. That's why we developed a concept called helping children at home. They prepare the modules and given training to them. Now they are all at it. At least 7 countries are now following it up and doing these services. As the National Association of School Psychologists strategizes, school leaders are the forerunners. We have to take care of their wellness. That's why this presentation enlighten you how this self-care of these educators can be taken care. What are all the routine activities they can do, and what are all the self-care measures as far as these professionals are concerned. The self-care is a multifaceted concept involving physical, mental, emotional, spiritual, social, and occupational health and wellness. This we have to taken care very seriously, so that our professionals, without suffering, they can entertain their activities. Here comes this role of physical as well as occupational wellness is intertwined with the psychological self-care. That we are having these modules as in the form of training workshops, so as to empower the school psychologists to cope up and understand themselves, especially for the young and energetic school psychologists to know what is this self-care, how they can focus on themselves and know about their activities on day-to-day basis. These issues are very much pertinent. This occupational self-care is an important area they have to understand, and how the school psychologists are busy in always, and how they are engaging the daily activities, meeting students, parents, and taking assessments and giving interventions. In this respect, American Psychological Association listed out suppose if you are not taking care of yourself, what are all the damages for the individual and clients as well as for the profession? Individual school psychology is not having the self-care, definitely you may be suffering with depression, social, professional isolation, job satisfaction, suicide and chemical abuse and dependence, relationship conflicts like divorce, other addictions, unprofessional behaviors, ethical violations, stress-related illnesses. In the same way, for the clients, it will reflect as malpractice, suicide, boundary violations, loss of faith in therapy, the symptom exaggerations and guilt and lethargic symptoms, despair. When a professional school psychologist fails in his duty, definitely it will affect directly by the clients. In a way, the profession is also suffering. Nobody will trust this profession by this way. Loss of credibility, lawsuits, attribution, negative media attention, cynicism, and disillusionment. These are all some of the concerns for the school psychology profession when we are not having the self-care. Again, some of the warnings are loss of pleasure in work, depression, inability to focus or concentrate, anxiety, substance use, more frequent clinical errors, less contact with the colleagues, workaholism, persistent thoughts about clients and their clinical material, intrusive imagery from clients' traumatic material, and increased cynicism and overgeneralized negative beliefs, increased isolation from or conflict with inmates, chronic irritability, impatience, increased reactivity, and loss of objectivity and perspective in work. Finally, this suicidal thought. These are all some of the concerns how we are coping up with the occupational stress and how to overcome with this. We can have this spiritual self-care, whatever the religion they may have, whatever the grade and nation they may have their own way of doing spiritual self-care. Likewise, this socialization and self-care helping the school psychologists to work together and do the things in a positive way. Not only the school psychologists, school counselors and school teachers are most important to give this self-care. This APA advisory committee suggests some of the prevention and the wellness for the coping up this self-care activities. How this self-care is to be ignored and how we have to balance in the life. How balancingly we can empower ourselves and how we can have the benefits. This is guided by the APA Code of Ethics. When time permits, we have to understand this awareness of the stressors and use self-assessment and plan coping strategies. Maintain participation in consultation, therapy, and treatment needed. Take care of yourself. Get an adequate amount of sleep, and they have to regularly take care of this food and leisure time, and they have to plan ahead and do the necessary things in such a way. These are all some of the resources available for the self-care of the professionals, such as newsletter articles, web pages, and web article, digital media, newsletter, like APA, this National Association of School Psychologists, also providing the materials for the school psychologists that we have to take care carefully and do the things in a better way. Likewise, how we are having some of the activities through INSPA, we are having above school psychologists to monitor and encourage them wherever they are required. This some of the essential needs is reduce the occupational hazards, help building the resilience, model healthy behaviors, promoting quality of caringness, and forties relationships with clients and others, enhances self-esteem and confidence, attributes to realistic goal setting. These are all some of the concerns, how we are entertaining, being this, organization. We are helping these professionals to take care of themselves to enter into the profession. With this, I am thanking one and all present over. Due to the time, no capacity, we are not able to go in detail. This briefly, I can throw this idea so that those who are entered in this profession, they can think over how they can take care of themselves before entering to this practice of counseling or educating the children, in whether it is educational or in the mental health. This will be helpful for their things. Thank you very much for the.
Thank you, Dr. Rahman Lingan. I'm very pleased. I'm very happy that to hear such a good presentation from you, especially the fact that you are taking a lot of self-care mechanism and counseling, plus the traditional methods of treatment. They are very outstanding features that you have in your program. Thank you very much. So let's go on to the next speaker. I think, Dr. Ramalingan, you have a lot of questions, but we have to wait till the end. We have
Sure, ma'am.
another.
Sure.
Okay. Let's go to Mr. Sajib Hussain of Bangladesh. Sajib, you can give your presentation, but I don't think we have a lot of time, so please go ahead and finish it maybe 5 to 10 minutes. Sajib, are you ready for your presentation? Sajid, go ahead. Please highlight on the points that you would like to make on the issues that have to be resolved, the suggestions. Please go ahead.
Shadi, why don't you go ahead?
Shajib, are you there?
I don't think his sound is working. His sound is not working.
Sound is not working. Okay.
Uh-oh.
Okay. Now, in that case,
In that case, we go to Dr. Atlak. I think Professor
Can you hear me?
Baruti, would you please go ahead and introduce Dr. Atlak? We've been waiting for him for a long time. And
Ma'am, can you hear me?
oh, okay. Sajib, go ahead.
Okay,
I'm
ma'am. Sorry.
Okay, go ahead if you want to.
Okay, ma'am. Sorry. Can you hear me, ma'am? Sir?
Yes.
Okay, I'm presenting. Sorry for disturbance. Presenting on impact of COVID-19 on education and mental health of students. Introduction. Coronavirus infection disease or COVID-19 is a highly contagious pandemic. It has become known the whole world as an incurable disease. Coronavirus has disrupted human life all over the world. The virus has placed all political, economic, social, and religious systems under the house arrest. At the same time, it has crippled the nation's backbone, all education systems, by adversely affecting students. Lockdown is going on all over the world due to coronavirus. And next point, that is why coronavirus is having a bad effect on children or students. School, college, madrasa, university, in a word, all educational institutions have been closed for a long time and students have become separated from education. Although some of the lessons are provided with the help of the information technology, it is not possible to reach all the students properly. Even those who are going to be reached may not be able to receive education like real knowledge in the right way. Although it is much easier in developed countries, it is more difficult in underdevelopment and developing countries. And number three, the effect of coronavirus on children or students. Meritorious students uh, meritorious students are becoming independent and unprofessional after being confined in the corner of the house for a long time. The minds of the students are getting depressed and losing their creativity. Their physical and mental development is being hampered. Ignorance is covering them because they have been hiding from their studies for a long time. Mobile game, computer game addiction, pornography addiction are also seen among the students. Suicidal tendency are also seen due to the creation of the disorder mentality. Many students are addicted to drugs and crime. Due to this, crimes tendency is increasing the society. This effect on children may cause problems in the future world. In these few months, the world has reached the extreme stage of misery. If these countries is not possible to expect any of the current students to be talented as Einstein or Newton, if this pandemic is not controlled very quickly by taking the necessary measures, it is expected that the world will become incompetent. Students make up a large part of the world's population and are the future driving force of the world. If this future generation is not managed properly, then the management of the world's ahead may not be good. Solution of this problem: parents should therefore give proper guidance and advice to their school-going students to prevent it. The government should be careful enough, such as a PPE wear and continue teaching while maintaining distance. Then maybe this fatal condition can be alleviated somewhat. Excessive use of mobile or computer should be avoided. Students should be encouraged in the reading advice books and good stories books. In addition to teaching a little in school, online teaching must be ensured for everyone. Teachers should always extend the helping hand. Thank you. Thank you so much.
Thank you, Sajiv. Thank you. You've done a good job. It's very good, except that the slides were not big enough, but we could understand very well. Thank you, Sajiv.
Okay.
So let's go on to Dr. Akhlaq. Sir, Professor Dr. Akbaruddin, would you please introduce?
Yeah, I'll
Dr.
say a few
Akhlaq?
words. You see, Professor Dr. Akhlaq is a very busy person. Recently, we found a very interesting photograph with him with the new US President, Biden. And we were very happy. You know, Dr. Akhlaq is originally from Bangladesh. He's a Bangladeshi American. and he's a professor in the University of Alabama, and we're extremely proud of him. He's doing a great job there, and he has been giving us time in a number of these programs that we have arranged so far. So today he's the guest of honor, and we are waiting to listen to him. Dr. Akhlaq, thank you.
Thank you, Dr. Akbaruddin, for your gracious remarks. You have always been very gracious. I am actually, yes, I'm from Bangladesh. I'm a graduate of Dhaka University in economics, and then did my doctoral work in the US. So I was listening with quite interest about this topic, and it has really large implications. So I would be making a few comments. As you may know, I work in information technology and public policy. So that's, I would shed a light on a work that I did many years ago, and where internet was becoming very something of a panacea, as if it's going to solve our world problems by connecting to each other, where we'll create communities of power and also where people will be empowered. And I had a suspicion in the fact that I thought that once people are connected, good people's connect and they're very empowered, but also bad people's connect, right? So when you are creating these avenues of clusters of connections, you would see good things happen as well as bad things happening. And in fact, you have seen that. With regards to this pandemic and what I'm talking about, is you would see that that we are now isolated, but we are connected through this virtual world, right? We are connected, and we are connected to the virtual world, and we have created our own world given what we know from virtually, not from reality, but from virtually, right? So some of you I have met, but some of you I haven't met. So we are creating a world, a virtual world of reality. But when we check reality from our experience, we actually test that knowledge and say, okay, maybe this is not what I thought, right? So that's how we experiment things. So as you know, recently in the US last week, we had a very serious issue of one of the person who is mentally disabled, mentally challenged, had killed 10 people, right? And this is, you might think this is very unusual, but if you think about a mental instability, people who are sitting isolated, they create their own virtual world from what they see online, okay? So what we see online is Facebook, and with all kinds of social media, these people are talking to their own world, own people who are similar to them, okay? And when they compare with the other world where they're successful, people who are successful, they're doing great things. As our last presenter was talking about, students who are actually challenged, and they see that the others are doing great, people in the US, people in Bangladesh, people are having fun, right? But they're not having fun. They're isolated. They're sitting in a corner room. They're talking to their parents. The parents are not talking to them. So they create a very isolated world. And we have to come to reality that even our own kids, we sometimes don't know what they're doing. They create the isolated world from so what they have done is they have created their own world into isolation. And when we see the others are having fun, they're doing good, they actually corner themselves. You have to understand, mental problem has to do with when they challenge their reality to their own world. So their own world is challenged. So what they do is we actually regress. They come and they isolate themselves. Okay, I have some friends who actually do mental, who are physicians, who are psychiatrists, who actually deal with them, and we actually talk about these issues because we have kids too. We have our own people and challenges that we face. So what is happening is we are actually always we take care of people who succeed. We actually say, Shabash, you're doing great. And we're always looking at people who are successful, but we do not mention people who actually fail. We are not empathetic, right? We don't empathize with people who may not make it, who actually are having difficulty connecting. They don't have your bandwidth, right? So they may be watching a small video, but they cannot watch all the things they want. So what happens is you have to talk to people who cannot make it. We have a role to play. Although this is not our expertise, but we are human beings. We have to connect to humans who may not have that opportunity that others have. So one thing that we have noted is that we should always look at people who fail and find out why people are failing. And of course, people who succeed have the opportunities. They may have better intellect, or they may have better opportunities to connect, right? And so they will always be better. But there are people who are actually outliers, who are not able to succeed because they're not mentally capable, or they may not have the resources, okay? And they're not people who can reach out to them. There are very few people who actually reach out to them because they don't care. The people don't really care for them. So I think the mental issue has to do with us, the majority of people who have created their own world and who are successful. But we do not see people who are actually failing. So what we have to focus, and then some of the Nobel laureate in economics particularly have focused on this issue of failure, that most of the innovations are coming from failure, right? People who have tests and they fail and then say, okay, they know why they fail. So they go into and invest in that failure thing. So we have to know how to invest in failure. Mental issue is actually people who are mentally unstable are their own creation, are the world. I mean, they're actually becoming better because they find out people who care for them. They're given some medications and others, and they're actually in a normal life. They're with people because they find their friends, they find their society, that others do care for them. So what we have to do is we must look at the failures. We must find people who are failing in this world and attach to them and talk to them and find their home so that you can create a network of opportunity for these people. And this pandemic has taught a very important lesson. And that important lesson is isolation is inevitable, right? Isolation is inevitable when you're not connected. Think if this happened in 1918 or even 2000, year 2000, when people were disconnected, right? Now we are connected with Zoom, we are connected with the virtual world. Actually, the pandemic has helped us understand the virtual world, but we have to humanize ourselves. We have to humanize and connect and look at the failures so that people who are suffering from mental issues, these are all issues because they have created their own world. They don't see a world, there's an opportunity. They don't see an end of light at the end of the tunnel. They don't see that because they see that their parents are not talking to them, their friends are not talking to them, they're completely without hope. So I'll end with that. I think this is a great discussion. I thank PRC for arranging this very important topic. and we should continue talking about this in the future.
Thank you, Dr. Akhlaq. It's been very nice to hear that, we are connected so much, but we are not doing enough for the people who are failing. So that's a very serious issue that we have to look forward to. I think we can now go for some questions. There are a lot of people over here who have not said anything, so we would like to have questions to the speakers. Please go ahead and place your questions to the speakers. I have a question to Professor Panch Ramalingan. I would like to know that you are doing a lot of work with the psychologists. Are there enough psychologists to take care of this vast program? And how are you building up the strength of psychologists in your country?
Thank you very much, ma'am. This is the commitment we have to do for the community. Then I am associated with the Psychology Association way back in 1993 onwards. When I was in the research scholar, I had an opportunity to attend the conferences that inspired me to involve myself in this process. And in 2005, I had been assigned this editor of Indian Academy of Applied Psychology, the renowned journal of the Indian psychology community. I made it possible that journal to be Scopus Index, API Index, and all the leading databases for more than 15 years. In the meantime, I had an opportunity to attend this International School Psychology Association conferences in 2008, 9, 10, 11. We organized it in India. These are all some sort of commitment, how we are committing ourselves for the profession. That if you commit yourself and do wonders, then definitely people are there to help and support. For Indian School Psychology Association, now we are having 813 members. That these are all, we made it what you call it as automatic. We created a website. If those who are interested, let them register there. We will verify their qualification and suitability for the organization. Then automatically the certificate will go, then the receipt will go, the ID card will go. Then there is no need of manual work. Everything we made it possible through online. Then naturally it creates a trust among the organization and the members. All the members are listed in the website. There is no hide and seek. You may not hide some of them and tell these are the members. That nothing. Everything is transparent. And likewise, we used to give importance to the members in such a way. Each and every state we are having a state convener. In turn, this state convener is having a ground level work with the coordinator with the members. One side we are doing it professionally, other side we are getting in with the government department, especially the education department. How we can help the children through the teachers, how we can conduct the training program for the teachers. These are all some of the regular activities since 2009 onwards we are taking care of it. Likewise, every year we are having get together kind of annual conferences. There people used to meet and discuss, and they will come forward to help each other. Every year we used to encourage the professionals. At least around 25 to 30 professionals will identify, encourage in the form of different awards. That these are all for the professional commitment, how we can entertain them. What are all the measures possible for the development of the profession as well as the individual, that we are taking care. One side we are helping them for the publication, other side we are giving opportunity to present their research contribution. Likewise, this is multifaceted activities. That could be the reason. I was the founder, person for the Indian School Psychology Association is concerned. I need to have the strength on my side. I involved two elderly people, Professor G.P. Thakur and Professor Mukhopadhyay, who was the guiding force for me to venture these activities. So now I may myself can do things in a better way. That's why I assumed the president from 1st April 2020 onwards. Fortunately, this COVID is a curse or a boost, we may not know. All the activities are now happening through online. But our members are very active. At least 70 to 80 members in a meeting, they will participate and do things in a better way. In that series, our Colonel Ashraf as well as our Professor Akbuddin, these are all the people they have delivered webinar series. It is in a way inspiring. I feel it honored to collaborate with the PRC because of this COVID. Some of the activities are curtailed, but nevertheless, we will have a collaboration with the PRC. We will do wonders, especially for Bangladesh. That is our wish. Definitely, we will achieve it very soon. Thank you very much, ma'am, for asking this question.
Thank you. Thank you very much, because you've taken a big program and I congratulate you for your efforts. Achahade, would you have some comments on the issues that we've been speaking about on mental health of children? Please unmute your microphone.
Not really.
Okay. Anybody else? Any more questions? Mr. Ashraf? Maulana Ashraf, do you have any questions?
No, I don't have any questions.
To any of the speakers? Any comment?
No, it's fine.
And how would you like to use all these ideas in Bangladesh?
Actually, Dr. Panch Ramalingam is a guru in this field, the School Psychology Association, and then in updating and standardizing the psychological journal, and then the association, making it effective. He has got a lot of contribution, and it is very inspiring. Dr. Balan also is now. Both of them have given wonderful presentations, and that has made our session very rich. Thanks to both of them. And
Dr. Balan has a comment. Dr. Balan, you would want to make some comment?
No, doctor. So I really appreciated and really big gratitude to the organizer, especially Prof. Panch Ramalingam, Prof. Kamal, Prof. Ashraf, and also Dr. Ashklaf Aki from the US, and Prof. Akbaruddin Ahmad. And I really appreciate for the time and opportunity given to me to share with some of the experts from everywhere, UK, US, India, and also from Bangladesh. Thank you so much.
I think we are very much privileged to have so many good speakers in this forum. Are there any more questions?
Just one question.
Sure. Go ahead, Dr. Kamal.
Yeah, and my question is to Colonel Ashraf and as well as Professor Akhlaq. What is the status of schools in Bangladesh and in the USA? Are they open now?
In Bangladesh, the institutions were told that I have shown you. The initially government said that it will open in September 2020. We did not, and then later it was said that it will in November. Then again no, and then in March it was scheduled that on 31st March it will open. But now again, as the pandemic, infection has increased, so it has been changed again. In fact, the schools are now online education, and at times the schools are inviting, well, the teachers are coming to the schools, but most of the time, I mean, the students are not coming and joining the schools. Some of the schools are, arranging some games like cricket and other things, not much of things, but then yes, giving some chance to the students to come and adjust in the field, use the field and use the facilities is always interesting. But just because the pandemic has very recently, the infection rate and then death rate has increased. So again, people are quite cautious. I hope that with everybody's cooperation, inshallah, things will go ahead.
Thank you.
Mr. Kamal, thank you for this question. I think this is a very important question for many reasons. In the US, the school has been open, particularly where I am in Alabama, which is south of US. The school has been open since 6, 7 months, maybe 8 months now. It's fully open. The reason what they did is they collected data first, right? So, and they made sure that the social distancing was possible. So what they did is they categorized the school. I'm talking about high school now, not talking university. The university has been virtual for last couple of months. It's just started this semester from recently. But so what they did is they staggered it. They did with like from student's name, last name from A to let's say A to F. They will come on Mondays and Wednesdays. Okay. Then they did for other letters. So they organized it so that the school wouldn't have more than a certain amount of people, and they could do the social distancing. As you know, the school, you cannot really do social distancing in school, right? The kids are there playing, but they'll have masks on. They'll have when they enter the school, there will be people there to make sure they're they don't have COVID and all that stuff. And it's been very organized. So, and there has not been a single case. And we are talking about some 3,000 students in one school. 3,000 students. It's huge, right? It's actually like a university. But not a single case, because they would, if there is any issue, they would detect and they will send this kid home. But not only that, they actually follow up through virtually, through messages and all that stuff. So I think you can actually do it. You can do opening the schools, and which is has become very important for the economy, because the parents are working, right? So if the kid is staying home and the kid, someone has to stay with the kid in school. So it was very important that the schools were open, and now all the teachers have been vaccinated as of I think almost a month or so. They have been vaccinated. So these things are very critical. So you have to use some scientific, data collection to make sure the school is actually open, because the kids do suffer. As you know, in Florida, they did a study to find out that especially elementary kids who are from KG or first grade to fifth grade, they were actually not learning from home. Although they're sitting there, learning is actually a peer thing, right? They learn when they sit with teachers and the teacher finds out. So they have, the state has allowed that you can keep the students back 1 year because they haven't learned. So you have the option to do that. So I think it is very important that we have find a way for kids to actually send back to the social world and in the classroom. We have to find a way to do that. And some schools do it better than others, but do not just leave them alone at home and thinking the virtual they're actually learning, which is I have students. Some students are very good. Some students are not really doing anything. I mean, they have to follow up. So that's a very good question. Thank you.
Thank you very much.
Thanks a lot. Any more questions?
On this point, let me add one thing. Like the way he is saying, the students are students. I have seen the students. One is everybody is using the mask, and now what is the fun is that one is trying the other's mask. Let me see your try. So
Very interesting.
this is the fun part of it, but the very serious part is, in our country we lack trust. We do not have information which can be trusted, and not even the government information, very least. And our politicians have made everything political, and everybody will comment on a subject which they do not even know. He may be a Maulana or he may be a politician, but they will, in full swing, they will keep on commenting on the thing. So that has created a problem, and then now nobody knows, nobody really believes how many data is coming into in the declaration. And again, so if the situation cannot be trusted, then which guardian will risk his or her children to go to the school and get infected? And that is one side. The other side is the schools are now actually are struggling. It's a very dangerous situation. I know about the teachers preparing the lesson plan, preparing the questionnaire, and preparing the online exam sheets, checking them. It's not an easy thing. The teacher's house has become a studio because they are recording it and putting it in the YouTube. Now, who is taking care of the students of the children of the teachers? They have to also go, and so it has become a but I know the government also is talking about it. But in our country, the problem is everybody wants to be do the job. Everybody behaves like a servant. Government has said, like, okay, we will provide 5G. Now people will give a jump and say that, okay, do this thing, do this thing. They want to make points, and then is oiling type of thing is a very unfortunate. I'm sorry that I'm making a remark like this, because people are not proficient. People are not really doing the thing, handling the thing in a patriotic way. Seeing the that is what is required. In our country, the education quality should not be lost, and we should all sitting together, discuss and find out, and there will be some alternative. There has to be alternative. This way we cannot go on. And again, in your country, you said the government has permitted to retain the students for 1 year. And in our country, government has declared auto pass. What is auto pass? This is absolutely, we have already suffered many years. 1973 auto pass was given, and still those people, they curse, because in 1956 auto pass was given, and still it is a very sad story. But the government has done it. Now people will not talk against it, because maybe they will be punished, or there will be political aggression on them. So it has. That's why I'll always say that government or non-government, in our country, education is so important. It is the only capital we have. Our raw material is the children, and we got to give them the best possible education, and they will become automatically the asset of this country. Our children are quite smart. Only thing, you got to give it in proper way. There we are lacking. Somehow the other, everything is politics. We have to get out of this foxhole, and if we try, things can be done. Things can be done.
Thank you.
Thank you, Colin Ashraf. So shall we end this session? Should we hear something from Professor Akbaruddin?
Yes,
concluding remarks? Sir, are you
Yeah.
there?
Yes. Yeah, you can hear me now?
Yes, I can hear you. Yes,
all right. I would like to thank all the participants and the speakers and the guest of honors, the special guest, and of course the chair and the co-chair. We are very grateful to all of you. You have taken a lot of time, and we hope that we're going to discuss about this issue further. There are certain other angles that we need to look into. Like, I stay in Dhaka city, and I've got grandchildren going to some of the top schools here. And I find that these children, they are doing their classes all online and spending 4 or 5 hours every day. And then they also have homeworks and all that stuff. Some of the smart kids, they're also doing like karate classes, Arabic classes, sitting here. The teacher is in Egypt, etc., etc. But the saddest part is that we have sponsored 4 schools in our village once upon a time, which is now a town, Upuzilla, and it's a municipal city. Over there, we have 5 institutions, and there are no children. Nobody is allowed to go and attend schools. Now, these are all private schools. Here, when you say private schools, the government pays 90% of the salary, and the 10% is paid from the school fund. But the children are not going. There are no facilities. Even if you want them to start online classes, they can't, because these are children not from well-to-do families. Then we have the madrasa and the orphanage, the same problems. These are all closed. And the worst part is the degree college. That is also closed. And I'm really worried about how long this is going to last, because there have been certain certain people commenting that this pandemic may last even for 7 years or so, because now new strains are coming out, new strains, and there is not one vaccination which is going to help cure all your ailments. So there are some very bad days ahead. But as Dr. Akhlaq pointed out, if we can do that on experimental basis, like distributing the classes in a manner that we do not have too many students coming at the same time, so that social distances can be maintained. I think I'll try one of these things in one of our institutions on a pilot basis. We have done this for a madrasa, and we are getting some good results. Like tomorrow, we are going to give pagri to 10 students who have completed the memorization of the Holy Quran. And there'll be a big function, and these pagris will be given to them. This is certification that they have memorized the Holy Quran. And tomorrow is a Shai Barat over here. So we are going to make use of this particular event, and we'll grant them the pagri as well. See, we are stressed out ourselves, seeing our children sitting at home, busy with their laptops or these phones and other things, and there's hardly any place for them to go out and play, and things are not very not very good at all. Not very good at all. Although there are parks in and around, there you hardly find any people, any children. There are some old people going there for walking and all that. Like, I have stopped going to the parks. I go to the rooftop, and there's a rooftop garden. I walk over there morning, evening. And I've stopped going outside the house. I got COVID myself, and I was 12 days in the hospital. And I think that was the worst time of my life. And things are getting from bad to worse. Bangladesh had done fairly well, but then all of a sudden, the numbers started increasing over here, because we found people from other countries were coming in. And recently, the government has started putting a lot of restrictions. Like my own daughter is supposed to come, but she can't visit Bangladesh If she comes in, she has now been allowed, but then she has to stay in a hotel of the government's choice for 7 days quarantine. Then she'll be tested whether or not she is negative. Then only she'll be allowed to enter the city. These are all very difficult times that we are passing, and let's all pray that there is some solution in the near future. Thank you very much, all of you, for all the time. Thank you so much.
Thank you. Thank you, sir, for your final speech. That was very good and very illuminating. So I would like to thank everyone today for this wonderful evening here in Bangladesh. And personally, I would like to thank people who have joined from England, from USA, Malaysia, India, and also from Bangladesh. We're very happy that you've been given us so much idea about the situation of COVID and how we can tackle those problems. Let's all stay well. In fact, I have a message to you that Dr. Mahfouz, our CEO, he's down with COVID and he could not join this program. So let's pray for him and let's all pray for each of us. And with that, I would like to say goodbye and thank you very much.
Thank you.
Thank
you so
you.
much. Thank you. All the best. Thanks a lot.
Goodbye. Thank you so much. Assalamu alaikum.
Wa salam. Thank you so much.
Thank you.
Thank you, sir. আপনি
Thank you so much.
এতক্ষণ পর্যন্ত থাকলেন।
Thank you, Akbar bhai. Thank you very much.
Thank you so
Have
much.
a good night.
Hello, Sam. Thank you so much.
Thank you, sir. Assalamu alaikum, sir. So
Wa
shall I
salam.
close now?
Yes. Thank you so much. He is a
Thank
tech
you.
guy, the secretary. Thanks. Bye-bye.
Assalamu alaikum.
Thank you, Tawheed. Well done.
Thank you, sir.
Well done, Tahir. Thanks a lot.